Hello, everyone. My name is Oshin Oliver, and I'm a student in Georgian College in the Food and Nutrition Management course. Today, we'll be getting a presentation about food allergy and food intolerance. We will also understand about their differences. What is food allergy? It is a type of reaction that happens to certain people when they consume certain food ingredients. And these interactions can come as moderate symptoms or they can also be fatal in nature. Whereas food intolerance is a non allergic hyperfood sensitivity. And this can refer to a variety of conditions due to the consumption of specific food items, such as lactose intolerance, etc. What is the importance of food allergy? Food allergies can have an adverse effect on health and can be fatal in nature if it is very severe. There are different types of food allergens such as milk, eggs, fish, tree nuts, peanuts, and soybeans. What is the importance of food intolerance? It can provide an unfavorable response, which can be due to a food item or the chemical present in the item, causing it to be undigestible by our body. It is also a non-immune response. Food allergy is an important concept because it can cause severe symptoms such as limited breathing, abrupt drop in blood pressure or anaphylactic shock, and suffocation due to the swelling of the throat. What is anaphylaxis? It is a type of hypersensitivity where the airway is blocked due to the swelling of the respiratory system, and this can also cause or progress into a respiratory collapse. Epinephrine is a naturally occurring chemical which is found in our body and it is produced by the adrenal medulla. This helps in regulation of blood pressure and smooth muscle and relieving the symptoms of anaphylactic shock. What is the concept of food intolerance? It usually occurs within a few hours after eating certain food items, and the symptoms can be vomiting, stomachache, diarrhea, gas, and skin irritations. There is a difference between food allergy and food intolerance. Food allergy can have very adverse effects on health compared to food intolerance, and food intolerance has mild type of symptoms. Here's a table that shows a difference between food intolerance versus food allergy. So food intolerance is not life-threatening, whereas food allergy is life-threatening. We have gas and bloating in food intolerance, whereas food allergy mostly starts with vomiting and nausea. The types of food intolerance can be lactose intolerance, gluten intolerance, sucrose, maltose intolerance, histamine, tyramine, and MSG intolerance. Lactose intolerance is the most common intolerance seen due to the lack of the lactase enzyme in the body. The common food allergens are peanuts, tree nuts, sesame seeds, milk and eggs, fish, crustaceans, and mollusks, soy, wheat and triticale, sulfites, and mustard. Our responsibility is to be prepared for a food allergy emergency. This can be done by recognizing the signs of anaphylaxis that is shortness of breath, any kind of skin irritation, abdominal pain, that's nausea and vomiting, and we should provide the appropriate medical care. The care can be given in a four-step process. First, we have to be aware of the food labels and the allergies that a person is facing from. Then we should also know the consumption or the early warning signs that contribute to the allergic reaction. Step three would be to be aware of the experiencing of a different allergic response. And step four is to make readily available the right type of medical attention and treatment for the patient who has been affected. The next important step is reporting, where we have to provide a detailed explanation of the reaction, including the product that was consumed and the drugs used for the treatment, and also the hospital's contact details. To quickly summarize the topics covered today, we have spoken about food allergy, that is negative reaction to products containing food allergens, food intolerance, that is the inability to digest certain food, and anaphylaxis, which is the swelling of the throat due to certain hypersensitivity. Be prepared for food allergy emergency, and that is through the four-step process. Read the labels, the knowledge of warning signals, being aware of allergic response, and medical treatment. And final step is to report the incident. Have Let's have a quick quiz. Describe a person who has difficulty digesting a particular food. It's intolerance. Someone who reacts to a substance in the environment that are harmless to most people. That is allergy. And the injection used to improve breathing and stimulate heart in cases of anaphylaxis. That is epinephrine. Thank you and have a nice day. These are the references used for this presentation.